Hey everyone, and welcome to this explainer on decoding the SMC exam and the GemIIni solution.
Right off the bat, I want to acknowledge something really important. The unprecedented challenges facing displaced Sudanese medical practitioners right now are, well, they're massive. If you are navigating this total institutional collapse, I just want you to know you are absolutely not alone. So let's talk directly to you. You might be sitting there asking yourself, why take the GemIIni SMC course if I'm a Sudanese candidate sitting for the SMC? And look, that is a completely valid, super urgent question for all the graduates, senior medical students, and house officers out there who are desperately trying to prepare for the upcoming August exam. You need immediate readiness for independent local licensing, but the ground underneath you has literally shifted.
We deeply empathize with the chaos of academic and clinical displacement. I mean, the old way of preparing for this exam, it relied entirely on physical institutions and stable infrastructure, things that tragically have collapsed. You're left trying to piece together scattered resources, fragmented study groups, spotty internet. It's just incredibly tough. But compare that to the new way we're looking at today. The local GemIIni project was engineered specifically to tackle this exact crisis. It offers a structured, standardized, and most importantly, offline accessible lifeline. It delivers essential clinical knowledge directly to you, completely bypassing all that institutional chaos.
Okay, let's dive right into this, because this is where the strategy really kicks in. When we analyze the massive databanks of past SMC exams, a genuinely fascinating pattern emerged. We call it the 80% rule. So 80% of this exam is made up of heavily repeated core concepts, while only 20% is those variable, unpredictable scenarios. What does this tell us? It proves the SMC isn't just testing you on random medical trivia. No way. They are looking to verify a very specific doctor profile. They want to know, are you clinically safe? Do you understand local Sudanese medical law? Are you sharp on endemic diseases? If you can master this 80%, you'll master the exam.
To see exactly how this is baked into the exam questions, just look at how heavily they test Sudanese medical jurisprudence. If you spend any time looking at past papers, you absolutely know about the famous ORNIC 8 form questions. This is the official police and medical form required in trauma and crime cases in Sudan. Time and time again, the exam will throw this scenario at you. A trauma patient arrives, it's a suspected crime. What do you do with the ORNIC 8 form?
And here is the exact definitive answer pulled straight from the source exams. Rule number 1, providing medical service comes before filling the ORNIC 8 form. The SMC wants to be absolutely sure that even when you're staring down legal or police procedures, your immediate instinct as a doctor is patient preservation first. They're heavily testing your triage priorities in very real, acute Sudanese clinical environments.
Now, what's really interesting here is how core medical ethics make up a massive, non-negotiable chunk of that expected doctor profile. The exams repeatedly test principles like beneficence, non-maleficence, and, particularly, autonomy. For example, there's this heavily repeated scenario featuring a cancer patient who outright refuses chemotherapy because they just want to spend the rest of their life with their family. The exam asks you to identify the ethical term. The answer? It's always autonomy. You must respect the patient's right to make their own informed decisions. They want doctors who don't just memorize medicine, but actually know how to ethically apply it in the real world.
Next up, the SMC demands absolute, rapid-fire pattern recognition when it comes to local endemic diseases. Let's just speed through a few of these because they show up constantly. A European tourist needs prophylaxis for schistosomiasis? Boom, the answer they want is praziquantel. A pregnant patient gets malaria? You treat with oral artemether and lumefantrine. What is the most important factor in the pathogenesis of cerebral malaria? The SMC is looking for you to spot cytoadherence in the microcirculation. This stuff right here, this is the very DNA of the exam. You aren't just expected to be a doctor, you have to be a doctor practicing specifically in Sudan.
Which brings us to a highly recurring, direct question pulled straight out of the SMC exam archives. I want to really hook your attention on this one because it perfectly illustrates their intense focus on acute local protocols and national health statistics. The question goes like this. The most important cause of maternal mortality in Sudan is...
So the crucial point here is the answer is hemorrhage. Not eclampsia, actually not pulmonary embolism and not malaria, hemorrhage. Delivering this critical answer correctly proves to the council that you are a doctor who is clinically safe, situationally aware, and completely dialed into the specific vulnerabilities of the exact demographic you are treating.
But hey, let's do a quick reality check here. Knowing what to study, that's really only half the battle. The real question we need to answer is, how do you systematically master this 80% core curriculum while you are currently facing profound academic and clinical displacement?
Like, how do you prep when your hospital is compromised, your university is shut down, and your study groups are scattered all over the country or even across borders?
Section 2. The Local GemIIni Solution, your key to licensing.
This is exactly where we pivot from the immense, stressful demands of the exam to a highly actionable solution. Enter the GemIIni SMC Prep course. Honestly, think of this as your perfectly engineered cheat code. It's a literal lifeline, designed specifically to mobilize you for the upcoming August permanent registration exam. The curriculum isn't just some random data dump of textbook chapters. It's systematically distributed across 8 core modules that map perfectly to the exact SMC licensing blueprint we just decoded. You get 20 hours dedicated to internal medicine, 15 hours for OBGYN, 15 hours for ER and trauma triage, and crucially, 10 dedicated hours solely for ethics, professionalism, and Sudanese medical regulations. Because as we saw with that Ornic 8 form, you literally cannot pass without this knowledge.
All told, this program delivers exactly 120 hours. That number is absolutely vital. It represents the total high-intensity training hours of cognitive and clinical output built into the system. It's a structured, guided path designed to take you from a stranded trainee to an independently licensed practitioner, guaranteeing clinical safety and diagnostic accuracy every single step of the way.
But look, theory alone is not going to pass this exam. You need practice, massive scale practice. The platform houses an incredible 2,500 highly vetted clinical scenario questions. These are carefully designed with escalating difficulty levels to rigorously test your pattern recognition on all those heavily repeated concepts, everything from instantly identifying a Colles fracture on an outstretched hand to knowing exactly when to prescribe a gluten-free diet for celiac disease.
But what makes this truly revolutionary for the current crisis is the tech itself. Typical digital prep courses require high-bandwidth internet, which is a total luxury many simply do not have right now. The GemIIni platform, however, is hosted directly on a mobile app specifically engineered to support low bandwidth and offline access for clinicians currently inside Sudan. It deliberately bypasses infrastructure collapse to give you a completely frictionless, reliable digital repository right in your pocket. It's a total game changer. So how do you actually bridge the gap between where you are sitting right now and passing the exam in August? It is incredibly easy to onboard. Step 1, go to geneacademy.net and fill out the registration form. Step 2, you'll immediately receive your unique GA number and a starting entry incentive of 500 GemIIni points. Step 3, you instantly unlock and begin your 120-hour clinical readiness curriculum. It literally takes minutes to set up, but it structures your next few months completely.
We've broken down exactly what the SMC wants. We've shown you the 80% core concepts you need to focus on. And we've handed you the specific tool built to conquer it, despite the immense hurdles you are currently facing. The exam is approaching fast, but you now have a localized, offline-capable roadmap to success. So the only question left to ask yourself is this: are you ready for August? Head over to geneacademy.net and let's get to work. Thank you so much for joining me on this explainer, and we will see you next time.